Spine surgery has undergone enormous transition over the last 10 to 20 years. It started out as like orthopedic surgery, where the goal was to do really major structural changes to the spine in order to treat people with pain. It's gone from that to sort of the opposite extreme, where now we really look at how the spine functions and we try to make it function without pain within its normal parameters. And that's really changed. It's a different paradigm for how we treat people with spinal problems. People will say, oh, I would never have spine surgery. And if you really look at the root of that, almost always the situation is one of their relatives or somebody they knew had a spine surgery and it was sort of a catastrophically bad outcome. What happened a lot with spine surgery was fusions were done. There were very large open approaches. In the spine, the joints are called facet joints. So spinal fusion means the facet joint can no longer move. As a practical matter, surgeons achieve spinal fusion by putting in hardware that locks the two bones together. And then the patient's bone, the patient actually does the fusion. The patient's bone grows across and knits it together. So there's damage to the body from the surgery itself, and then there's damage to the body from the effect of the fusion. And those two things together make fusion a pretty complicated thing to have done. There's a lot of situations where, thank God for spinal fusion. I mean, we're always trying to avoid it for treatment of pain and in elective situations. But if your back is broken and the two parts need to be held back together, spinal fusion. We're going to put in hardware that's going to restore it and recover it. Spinal fusion is a godsend. However, for conditions that are more common, arthritis of the spine, back pain due to joint problems, routine issues that don't involve deformities or fractures or infections or tumors or things of that nature, spinal fusion is really not an appropriate option. We have better ways to treat you now. So we're at a time where doctors are starting to really switch from doing spinal fusions on people for these problems to really treating them in a very different way. And we've explored some alternatives which have offered us really better ways to treat these problems like back pain and spinal arthritis. A lot of those people who we used to think needed a fusion really don't. We can treat them today in less invasive ways, sometimes ultra minimally invasive ways, which are not only outpatient, but you can recover in hours and days instead of weeks and months. We can actually treat people with spine problems in a totally different way. I'm not just talking about doing the same old surgery in a minimally invasive or sort of a more modern way. I mean using a different approach, a different paradigm. It's gotten to the point now where someone in Phoenix could go into a doctor and have minimally invasive surgery, and the recovery for that might be weeks or potentially even on the month side, compared to something we might be able to do surgery in 15 to 30 minutes, eliminate your pain, and you're recovered by the time you wake up the next day. We're really reaching a point with different thoughts and different tools and different techniques of ultra minimally invasive surgery. That's our challenge here. We look at every single surgery we do. Our mission is to solve your problem in the least invasive way possible.